we serve 18 counties in western North Carolina, and the population is really heavily weighted towards Medicare and Medicaid population. RScan for us seemed like a natural starting point because our health system, with the aid of the group, was evaluating clinical decision support tools to integrate with the EMR that we have in our health system. So when we evaluated the various clinical decision support tools, we realized that RScan will help us move in that direction.
Dr. Dickerson first came to me about this. I was very enthusiastic because we need to transform healthcare. And it's not one single thing that has to transform, it's a number of things. And so how do we do it? And he had an excellent idea about how to educate physicians in advance of when they're actually ordering an imaging test about how to order that imaging test.
So I feel like engaging in this up front is going to help us better prepare for when this is required. We'd rather be in front of the curve as opposed to behind it. And also there's a lot of uncertainty out there in the provider community. How's this going to affect me? How's it going to affect my life, my ordering patterns? Is it going to affect me?
Well, we had to ask ourselves, how do we engage these doctors so that they will want to work with us? We realized they've been in this reporting quality environment for a long time with meaningful use. So when we were able to tell them, look, this is going to help your meaningful use metric, they were open to it. But when we started engaging them and say, this may reduce the hassle factor in the future, that was another area that they were very open to listening. Okay, if this is going to help me not get the phone calls to rewrite the order, or not get the phone calls to ask for contrast, things like that, they were open to it.
We had so many delays with prior authorization requests because maybe we weren't as aware of the Medicare standards for ordering certain tests. He proposed RScan as a way to speed things up, improve communication between radiologists and the clinicians in the outpatient setting, which we had sort of lost.
I'm looking at it as a gradual phase-in for clinical decision support, because if we look at the legislation and the timelines that are out there, it's not a switch we can flip. If that's the approach that we take, I think it's going to be doomed for failure. The regional medical directors that we have at the various hospitals that we serve have really engaged the medical staff based on the relationships they have. So in that way, our medical directors in radiology are engaging key stakeholders in the region to get them on board with embracing upcoming CDS legislation.
It was very clear from the start that this was something that was going to be good for our patients, right for the health system, and again, there's no other way to do it than to jump in.
The group really looked at this, and we didn't want to plug in our referring doctors into the various pathways that were outlined in RScan. We felt that if I took all this time to engage a doctor, I wanted it to be meaningful and useful to them. So by taking a random sample size of, say, 25 patients and then plugging it into the RScan tool and then looking at the outliers, we felt that the referring doc would find that more valuable and useful, because then I can look at the outliers.
We present the provider with their ACR Select results. We review some specific cases with them, address any specific questions they might have, and follow up with sharing the appropriate use criteria documentation that was specific to a particular case.
My initial reaction that I got from physicians was very positive, and they were extremely interested, and I saw them come up very close to the screen when we started bringing up their individual report, and I started reviewing the cases that were not deemed to be the most appropriate exams.
RScan has helped me realize that radiologists are not just people sitting in a room at the hospital somewhere reading CT scans. They are a resource. They are consultants with a vast knowledge that bringing something to the table to help me care for my patients.